When the weather is warm like this, we often spend our days at the playground, the ballpark, or in the garden, or maybe you work outdoors.
And when it's time to go back inside, how many times have you brought in an unwelcome guest with you? You spot a tick crawling on. Isn't that just ugly to look at? It's looking for its next meal, and of course with ticks comes the threat of Lyme disease, and there is a lot of that here on Delmarva.
Yeah, take a look at this map. The Centers for Disease Control and Prevention reports in 2010 the highest number of confirmed Lyme cases were reported in Northeast states, including Maryland, Delaware, and Virginia.
Isn't that incredible? Now, there are steps that you can take to lower your risk of contracting Lyme disease. So joining us today to tell us more about it are Jeff Farace, owner of Community Pharmacy, and Marilyn Williams, Vice President of the Lyme Disease Association of the Eastern Shore of Maryland. Thank you for coming in today. I've been battling ticks lately myself here.
They're very bad this year.
Marilyn, what is Lyme disease? Explain it to me.
It is a bacterial infection, and it's actually caused by a spirochete. So a spirochete is a corkscrew-shaped bacteria. It actually has a tail, so it's very mobile. It doesn't stay in our bloodstream, which makes our testing very unreliable. It'll actually burrow through out of our bloodstream into our organs. It can get into our brain, and it can actually burrow into our bones. Now, when our immune system starts saying, hey, there's a foreign invader here, it'll actually ball itself up into a little ball, what we call like a round body or cyst body form. And in that form, our immune system can't do anything with it. It can't fight it. And only a couple of antibiotics are known to be able to get to this cyst form. So the bacteria is very stealth. It'll actually join with our DNA.
Wow.
It's a very stealth bacteria.
And this is all caused by an infected tick, right?
Right. What's inside the tick, a lot of times when they're attached to us, comes right out into us. And it's not just Lyme disease. We use the term Lyme disease kind of as an umbrella term because the ticks are actually giving us a myriad of different organisms like Babesia and Bartonella, ehrlichiosis and Rocky Mountain spotted fever are probably the most prevalent in this area.
And the most common tick is the deer tick?
We have the deer tick here. We have the Lone Star tick. The Lone Star tick we might get more bites from.
Right.
And the Lone Star tick was just discovered. It came out just this week that it's carrying some new strains of Lyme disease. And we also have the dog tick around here.
Could watch out for that one as
All
well.
of them are carrying nasty bugs in them.
Jeff, what kind of problems can come from contracting Lyme disease?
Well, if Lyme disease is treated early, generally you can treat it with 21 to 28 days of antibiotics and you'll be cured. But the problem is that so many times it goes left unnoticed. You know, you don't know you got bit by a tick, you don't notice a rash. And the hardest thing is when they get to the point where it's been 6 months, a year out, then it's much more hard to treat. It's much harder.
Well, so what are some of the symptoms?
Well, you can have depression, chronic fatigue, headaches, sometimes you'll get the rash. If you have sudden psychiatric illness, I would actually, look at, Lyme disease as a possibility.
And early on it can hurt.
Well, early on, yes, you can get, it's actually probably in the second stage where you're going to get the arthritis. It can also go to the central nervous system. It also can cause heart block too.
Wow.
Yeah.
Now, while they generally do blood tests to determine whether or not you have Lyme disease, a negative test doesn't always mean you don't have it.
It's a clinical diagnosis. And the problem is we're so used to having a test and the test telling us. And even the CDC says it's only about 65% accurate. So our thing is to make sure when you have, whether it's depression, whether it's fibromyalgia, whether it's chronic fatigue, and there are cases, even people that have been diagnosed with MS, that make sure you get checked for Lyme disease, but you not only have to have the blood test, you have to have a doctor that goes by the clinical symptoms.
Which would include like the rash and things
Well,
like
the rash is only seen probably in about 50%, but do you have central nervous system? Do you have brain fog? Do you have paralysis? Do you have chronic fatigue? Do you have the fibromyalgia? A lot of the fibromyalgia is actually Lyme disease they're finding out.
Really?
Yeah.
So the question is, can Lyme disease be treated?
Lyme disease can be treated again early on, but if it's left untreated, it's very hard to treat. If you've had it for years, like Marilyn said, it will burrow into different organs. It's hard to find. That's when the blood tests are hard to find it.
Right.
And so then it becomes much more difficult to treat.
Now, I guess then the best thing to do is to prevent the tick bites to begin with, right?
Yes.
So how do we do that?
Keeping our clothes treated. Now, they came out with this really great study a couple of years ago. They knew that we are not going to be wearing long pants and long sleeves in the summertime. So what they did is they tested summertime clothing with spraying it with permethrin. Permethrin is a chemical. You can get sprays with permethrin usually at camping stores, Walmarts, or discount stores and stuff like that. So you're looking for permethrin, and you want to treat your shoes and your socks with permethrin. And I usually tell people to have a set of treated clothes and just stick them in your closet so that when you go out into your yard, you put those treated clothes on. By treating just your shoes and your socks, the study found that you were reducing your chance of a tick bite by 73.5%. And if the ticks crawl across your treated shoes and socks, they're already starting to die, because they found too in this controlled study that even if the tick does bite you, only 22% of them stay alive. So they're already dying when they cross your clothes. Now you want to treat your skin then with some kind of tick spray.
Okay, so my question then is this: what if I find one and he's bit me? What do I do?
Well, you don't want to disturb it. You want to just take needle nose tweezers and reach down close to the skin and pull it straight out.
Right.
We found that you do not want to put alcohol on it. You do not want to put a burnt match on it. All of those things disturb the tick. And when they've studied ticks under a microscope, they found that the more you disturb the tick, it starts spitting into you.
And that's when you get it.
That's when you get more bacteria. So all that's inside the tick is coming into you. If you wiggle it, if you put stuff on it.
And we actually have a kit here that has the tweezers in it that you can actually pull them out quickly, right?
Right.
Quickly.
Just get down close, pull it out quickly.
All right, Marilyn, Jeff, thank you so much for some vital information. This is great stuff here.
Thank you.
If you'd like more information from community pharmacy on Lyme disease, all you have to do is go to delmarvalife.com and click on the show tab.